So, hi guys, today we'll be looking at in our very chat GPT-ish session, we're going to be looking at different systems of education in different places. I just want to educate, to entertain, because I don't want to say educate, to tell people about the differences between the systems of Saudi is a developing country. Okay, let me just start by this. There are three types of, I think, countries. There is the developed countries, developing countries, and third world countries. So Saudi is a developing country, and Saudi Arabia is a developing country, and Kenya is a third world country. Okay, so I want to show you from a developing country's perspective of education, and I want to use this because it's actually quite near to our place, to Kenya. Okay, um, so first of all, we're gonna see the different structures of Saudi education and the governance, the structure. So when it comes to the structure, which I found very interesting, is it's the pre-primary, which is 3 to 5, which is optional. I don't think we have that in our country. There's compulsory 6 years, which focuses on literacy, numeracy, and Islamic studies. Again, Kingdom of Saudi (KSA) is a very Islamic state. It also holds top when it comes to Islamic tourism, which is great. They're in tune with their culture, which is amazing. And then there is and I think from 6 to 12 years, that's when kids are taught different types of things, maths, English, sciences, they're introduced, yeah. Then it takes 3 years. Okay. Then wait. The primary education. It takes 6 years, focus literacy, numeracy, and Islamic studies. Then we have the intermediate education, which goes for 3 years. It's ages 12 to 15. It builds general knowledge, sciences, and religion. I think up to there we are good when it comes to Kenya because it's more general. Then when it comes to secondary education, which is ages 15 to 18, the students choose between the general secondary, the academic track. I will say that is the 844, which prepares for university. Then we have the technical or vocational track, which prepares for specific careers. And then we have the religious track. So it's deeper Islamic studies in some schools. And I want you to take note, students choose between. Okay. I don't know if the CBC is, I'm not sure if that's because even the CBC is very vague, you know, it's not specific. Personally, the way I see CBC as is, okay, and that goes for 3 years. Then we have the higher education, which is over 40 public universities and many private ones. And these are the major universities, specializations include medicine, engineering, business, and Islamic studies. Okay, so their structure is, I will say, is the 6-3-3, and I think 4. Now, depending on the course, because you see, medicine and engineering can take 7. So it's 6-3-3-4. Okay. I think for Kenya it's 3-4-3-3-3-3. I think, I'm not sure. The curriculum emphasizes on Islamic studies, especially Quran, Hadith, and Sharia law. And I want you to understand that we are so very connected, the whole world actually. But when it comes to Arabic, yeah, when it comes to Arabic, it has a lot of similarities when it comes to our language because I think by now you know what Hadith is as a Kenyan because Swahili is our national language. So you know Hadith, what Hadith is. You know what Sharia, and Sharia law, yeah. The core subjects are Arabic, math, science, history, geography, and English. And in recent years, more emphasis has been placed on STEM, critical thinking, and digital skills as part of Vision 2030. And I want you to understand that the STEM is for the lower classes, the critical thinking and digital skills. So, what I need you guys to understand is that we do not have the STEM education in our system unless if you go to the IGCSE system. Okay, and I feel like this is important, and I feel like this is what separates us from the rest of the world as Kenyans. because we are more into theoretical thing. We have critical thinking that I'm gonna give it to Kenyans, but we lack. Okay, yeah. Then we have the gender and access. Education is segregated by gender, but both boys and girls have access from kindergarten to university. Female literacy and enrollment rates have risen sharply. Women now make up over half of university students. Non-Saudi residents, expatriates, often attend international school that follow foreign curricula, British, American, IB, I don't know which IB is, and Indian systems. So, what I need to explain for you, this gender and access, is that if you come to Saudi, they have a very strict rule of privacy, especially when it comes to ladies and gents, and also girls and boys. So if it's like one school in Kenya, we are so we have that. I don't want to call it freedom because it's everyone's culture. Our culture is more in we are more we have like, I don't want to say togetherness because this is not like separate, but there is respect to to their culture, and we have respect to our own culture. So when you come to KSA, due to their culture, you'll get to a school. It's one school, but it has different sides. One side is for boys, and the other side is for girls. They have their own playground. The girls have their own playground. They have their own dining area. The girls have their own dining area, and it's not like it's a boarding school, it's a day school, but there is that, there is the culture. And I feel like it really makes it easy, because most of the ladies would have, they were to have a culture where if they were to have a culture where every single day, they have to mix with the boys, they'd have to wear the abayas and cover themselves the whole day. But when with this separate system, it's good. Anyway, moving forward, reforms and Vision 2030. So the KSA is transforming its education system to align with its economic diversification goals, expanding vocational and technical training to reduce reliance on foreign labor, updating curricula to reduce rote memorization and promote problem solving and innovation, encouraging English proficiency and global competitiveness, investing in digital education, especially after COVID-19. So, what I will say is, um, the KSA are expanding on their vocational and technical training institutes, and also if you look, updating curricula to reduce rote memorization and promote problem solving and innovations. Okay, so I feel like, in Kenya, the educational system is actually going to, it's actually deteriorating, because right now we have that incident of Moi University. It has a lot of discrepancies. It has a lot of issues. There's a lot of concern that it's bankrupt or something, allegedly. But you see, these people are expanding their vocational and technical training to reduce reliance on foreign labor. And I feel like I wish Kenya was there. I wish we would even update our curricula to merge with our problems, especially as Kenyans, because most of the problems that we have, we either call for not either, we call for what do we call it? Foreign aid. We get the Chinese to build our roads, and I'm like, we have architects who are jobless. Like, why? And I feel like it's because our curricula has not been updated. It's not at par. But there is my thinking. But moving forward, we will know what the problem is. And also investing in digital education. I wish we would have that. Yeah. So the Saudi education system is state funded, and I will tell you for a fact, this place, from the moment your kid steps in school to the moment he or she steps out at university, it's all free as long as the kid stays at the average grade. Trust you me, I have seen it, and it works miracles. And a lot of kids, are kind of, a lot of families can actually take themselves out of this place, you know. So the next step, we will look at the education system in the US and what it entails. So you need to remember that the US is a developed country, meaning it's the top. creme de la creme, in quotes. Yeah, in quotes. I will put it out there. So the education system in the US is decentralized, diverse, and managed mainly at the state and local levels with some several oversights. Yeah. It emphasizes general education, extracurricular activities, and flexibility in career or academic pathways. Here's a breakdown. So the governments, there's no single national curriculum, but we get it because it's different states. And local school districts decide most policies, funding, and curricula. Okay, the structure is education is generally compulsory from ages 5 to 16. It varies by state again. So, the early childhood 3 to 5, which is optional again, grade elementary primary school, which is grades K5, ages 5 to 11. It focuses on literacy, math. I think it's general, yeah. And then there's the middle school, which is grade 6 to 8, which is 11 to 14. It's more subject specialized, teaches introduction to electives, e.g., music, languages, or tech. Then there's the high school, which is grades 9 to 12, which is ages 14 to 18. The students earn credits towards graduation, usually 20 to 24 credits required. The core subjects are English, math, science, social studies, and physical education. Electives, foreign languages, arts, business, technology, vocational training. Upon completion, students receive a high school diploma, and you can see that most people in the US are actually employed through not most, some, through their high school diplomas, and it holds more substance. Yeah. Then there's higher education, the community college for 2 years. It offers associate degrees and vocational programs. Many students transfer to 4-year universities. So universities and colleges is 4 year, offer bachelor's degrees in arts, science, engineering, or business. Then there's the graduate schools, master's, doctoral programs. Yeah. And then there's the curricular features, broad-based. Students study a wide variety of subjects before specializing, which is good. I understand why. Electives and extracurriculars, sports, arts clubs are considered part of education, which is amazing because when you look at Kenya, we are very diverse and we have everything for everyone. Then there's the assessments, grades A to F system, standardized tests, the SATs and the ACTs, often required for universities admissions. The flexibility, students can choose courses, change majors, and pursue interdisciplinary studies. Access and equity, the public, private, charter schools and homeschoolings, higher education. The current issues and reforms, the gaps in quality due to socioeconomic debates, over curriculum, history, civics, sex education, standardized testing, raising student debt from higher education, increasing push for STEM, digital literacy, career or technical education. So in summary, the US education system is flexible and diverse, emphasizing broad learning, personal choice, and extracurricular activities. It prepares students for many pathways, workforce, college, or vocational careers, but faces challenges in equity and affordability. So, so I asked what's the education system in Kenya and what it entails, and you'll be surprised. The education in Kenya has been going through major reforms in recent years. Traditionally, it followed the 844 system, but since 2017, the country has been transitioning to a new competency-based curricular activities, the 26333 three threes structure. Here's a breakdown. So the governance is by the Ministry of Education and NEC. Public schools are funded by the government, while private schools and international schools also operate alongside them. So the education structures. The old system was the 8 years primary, 4 years secondary, 4 years university. It was heavy exam oriented, criticized for stressing rote memorization and academic overload. So the system is 2 3. It should be 236 2 26333. Yeah. So the pre-primary is 2 years age, 4 to 5, lower primary, and as you can see, it's not like optional. So there's the lower primary for 3 years, grade 1 to 3. I think that is for 5 to 8 years. Then the upper primary from 8 to 11. Then let's just say from 6 to 11 years is the lower and upper primary. Then there is the JSS, which is 3 years. Then there's the national assessment where they go to the senior secondary school, which is 3 years, and then I think the university institution for 3 years. I don't know if I got it correct. Yeah, hopefully. Although I was like, there's like 6 years missing here. I'm not sure if I'm the one who's not reading it right, but you get science, tech, engineering, and maths, which do we have the facilities? Do we really have the facilities? Anyway, so the curriculum and assessment CBC focuses moves away from memorization, emphasizes skills, talent, creativity, problem solving, and values. So my question is, which problem solving when kids are being told to bring some funny things at school? I wish it would be focused on problem solving our needs. Core areas like languages, yeah, mathematics, science, social studies, yeah. Then there's the higher education, the universities, the TVETs, and yeah, access and equity, free primary education. Yeah, but I don't know if it's still working. Current issues and reforms, transition challenges from 844 to CBC. I wish they just made it better than just transforming the whole thing. I wish they continued making it better instead of brushing it all away. For me, I mean, CBC is good if it is put in good, like the system is clear. Because right now, if you ask people, okay, what's the way forward? What are the facilities? They are not yet available. Okay, efforts to improve digital learning and align education with Kenya Vision. I haven't seen anywhere where they talk about the STEM. Yeah, they just talk digital learning from a very, like, from years ago, I don't know, 20 years ago, they just talked of digital and nothing has ever been done. So yeah, you can see the problems that we have. So anyway, so I asked ChatGPT a question. A doctor who studied at a Kenya university cannot work in the US. Why? So a doctor trained in Kenya cannot automatically practice medicine in the US because the US has strict licensing and accreditation requirements for medical professionals, and here is why. So there's different education and accreditation standards. Kenya universities produce excellent doctors, but their medical curricula and accreditation bodies are different from those in the US. So the US requires doctors to be trained under programs recognized by the Liaison Committee on Medical Education or Commission on Osteopathic College Accreditation, COCA, for DO degrees. Since Kenya medical schools are not accredited by these bodies, the degrees are not automatically accepted, but it talks of how you can, if you go there, you can actually license yourself, the residency, whatever, ECFMG certification for legal and safety reasons. The US healthcare system has different laws, technologies, and standards of care, ensuring that every practicing doctor has gone through uniform training and licensing, helps protect patients and maintain consistent standards. Okay, so it asks me, would you like me to explain the reverse case where US trained doctor also cannot just move to Kenya and start practicing? So I was like, yeah. So the doctor trained in the US cannot because different licensing bodies, the Kenya medical practice is regulated by KMPDC, or any doctor or local or foreign must be registered and licensed by KMPDC before treating patients. US medical schools are not directly accredited by KMPDC, so credentials need to be evaluated and approved. Registration and internship. After medical school in Kenya, graduates, do a mandatory 1 year internship. A US trained doctor may be required to undergo internship or supervised practice. Then there's the local exam or assessment. There's the work permits, the healthcare system differences. And I want you to take a look at this. The US healthcare system is high tech and insurance based, while Kenya's system is a mix of public, private, and donor funded healthcare, which does not make sense. We have had the SHA scandal like a few weeks ago, and I don't think it has been sorted out the way it's supposed to be. There's a lot of loopholes. I can't believe it. Doctors must be familiar with local protocols, treatment guidelines, and available resources, which differ significantly from the US. In summary, just like Kenyan doctors must requalify to practice in the US, American doctors must register with KMPDC, pass assessments, possibly do an internship, and get a work permit before practicing in Kenya. So it asked me, would you like me to create a side by side comparison? So I was like, no. So I was like, what are Kenya's local standards and what are US standards? Because I have been thinking maybe it's our standards, our educational standards are not like top notch. Yeah. You'll be surprised on what I found out. Great question. So the Kenya and the US both train competent doctors, but their medical standards and requirements reflect differences in health priorities, resources, and regulatory systems. Let me break it down. Kenya's local standards, governed by KMPDC, Education and Licensing, Training Pathway, 5 to 6 years of medical school. 1 year compulsory internship in accredited hospitals, registration with KMPDC. So exams, and then there's the licensing, the focus areas, disease burden, heavy focus on infectious disease, HIV, AIDS, TB, malaria, diarrhea, diseases, maternal, child health, and rising cases of non-communicable diseases, diabetes, hypertension, cancer. Resource adaptation. Oh my God, you'll just get angry. So our doctors are being trained to work on limited resources. Anyway, training emphasizes working with limited resources, basic labs, essential drugs, limiting image. Like I'm telling you, our doctors are, hey, aki poleni, poleni. Community health, strong emphasis on public health, preventive medicine, and rural outreach, since many Kenyans live in rural areas with limited healthcare access. Why? We have money. Why? So the US standards, governed by LCME, USMLE, ECFMG, state medical boards. I don't even know those what they stand for, but I know they look so sorted out. But I know they also have their own problems. So education and licensing, training pathway, 4 years, exams, yeah, licensing, yeah, focus area, disease burden, high prevalence of non-communicable diseases. So in Kenya, we have communicable diseases, sorry, and in in the US, we have non-communicable diseases, the heart disease, obesity, diabetes, mental health disorders. Yeah, and less emphasis on malaria, TB, or HIV compared to Kenya. And I'm telling you, even in KSA, we have non-communicable diseases. So the tech and research heavy reliance on advanced diagnostic, MRI, CT, genetic testing, and evidence-based medicine specialization. Doctors usually pursue residency and fellowship training in narrow specialties, e.g., cardiology, neurosurgery, endocrinology. I don't know what that is. I don't know. I know cardiology and neurosurgery. Anyway, healthcare system, insurance driven with strict legal and ethical frames. So anyway, these are the key differences. Yeah, you can check them out later. Yeah. So Kenya standards prioritize public health, infectious and resource-limited medicine. US standards emphasize specialization, advanced tech, and non-communicable disease management. Both systems produce competent doctors, but they are tailored to their local health needs and resources. So, would you like me to allow to also show you how these differences affect patient care, e.g., how a pneumonia case might be treated in a Kenya versus US hospital? You need to brace yourself for this because it's just perfect. Let's take pneumonia as an example and compare how it might be managed in Kenya versus the US under their respective standards. So, a 7-year-old child with pneumonia, okay, Kenya and KMPDC standards diagnosis, whatever. So, this is Kenya. So clinical assessment is key because many hospitals have limited labs or imaging. Doctors listen for chest sounds. I think if you've ever gone, I once experienced it and they listened for chest sounds. They observed breathing difficulty, fever, oxygen, saturation, if a pulse oximeter is available. if a chest x-ray may not always be available. It's never available actually, especially in rural facilities. I was in Rongai, treatment guided by WHO and Ministry of Health guidelines. Sorry, first line empirical antibiotics, amoxicillin, oxygen therapy. If available, but often limited. Supportive care, hydration, fever control, and monitoring. Focus rapid clinical decision making with limited resources. High priority given to prevent death from common infectious causes in children. So, in short, unaenda unaskizwa. I think she's too learned, and that is the thing about our Kenyan doctors. I think that if they have limited resources, they can do this to 100. Like I think our doctors, it's one in the ratio 1:100. If I'm not wrong, 1:100. One doctor for 100 patients. Imagine if they had employed enough doctors so that we could have 1:10, and I think that is even many. I think it should be 1:3. The ratio should be one doctor for 3 patients, but here it's 1:100, and they can actually, can you just do the maths? If it's right now the ratio is 1:100, and that is the least, and our doctors can actually do and cure illnesses, detect illnesses through listening, through putting our hand, asking us who, I don't want to call them random whatevers, But she comes there with her stethoscope and everything, and she listens to the heartbeat, she listens to the crackles in your chest, and she's like, okay, you got pneumonia, it's at this stage, you're lucky it's not at this stage. She prescribes for you medicine. So imagine if she had the x-rays, or he had the x-rays, all of this high tech. Do you know how many how our system could be, could be, ingekuwa mbali, kizungu na ingekuwa mbali, alafu you can imagine this person has limited resources and can actually help 100 individuals. Do you know how learned she is? Do you know how much of a brain she has? Because I feel like that is, you're working with limited to no resources. Let's just even say no resources. I know public hospitals, you go there and you just talk to a doctor. She asks you, where is the pain? How are you feeling? How is the cough? How is the cough? And she's like, oh yeah, 1 + 1 is equal to 2. So you have this. Can you imagine if she actually had resources? So this person is a very smart person, and she's being overworked. She and he is being overworked, and they are being paid low cash, small amounts of money, and they're sacrificing a lot, and to some extent they're not even being paid. And for them to go out there and riot, and then being be what is it called, threatened to with job losses, that is just another level of, it's bad. Anyway, the USA standards. So this is treating the same 7-year-old who has pneumonia. So what if this pneumonia worked into a US standardized hospital? There will be immediate access to diagnostic tools, chest X-rays, CBC, which is blood count and blood cultures, viral PCR panel to rule out influenza, RSV, or COVID-19, oxygen saturation with continuous monitoring. Diagnosis is evidence-based with extensive lab and imaging confirmation. And the treatments will be antibiotic therapy tailored to results, e.g., amoxicillin for bacterial pneumonia or azithromycin if atypical pneumonia suspected. Supportive care, oxygen widely available, IV fluids, bronchodilators if needed. If viral pneumonia may not give antibiotics, focus on supportive care. Hospitalization if severe, otherwise outpatients follow up. Focus is on heavy reliance on technology and precise diagnostic. Treatment adjust based on lab evidence and guidelines, like IDSA, Infectious Disease Society of America. So if you look at this, we are still living in the same era. I think when these people, when you were told about communication in the past and there were smoke signals, I think this is one of those signals that we were also being told. Because if it's mainly clinical science, like diagnostic tools are signs. If you look, you may or you may, and this doctor has to be so sure that it is what she thinks it is, what he or she thinks it is, and actually diagnose you and give you treatment. He ngori. Huku ni full labs, chest, X-ray, PCR cultures, but in our areas is clinical science and limited whatever. So I'm even wondering, World Health Organization, why, who, why is this who here? And Kenya Ministry of Health, can't this Kenya Ministry of Health not do their own job? Do we really need who? Who the ones who are bringing us bad vaccines? They are bad, all whatever. Pragmatic. Yani, it's so. This is so. This is so bad. Let's go. Let's continue. Would you like me to do a comparison, but for a chronic disease like diabetes and hypertension, where the contrast is even bigger between Kenya and the US? This is crazy, man. So diabetes type 2 management in Kenya versus the US, because chronic disease highlight the resource and system differences very clearly. Now let's oh my god, I'm even scared of looking at this. So the KMPDC standards, basic tools, blood glucose, finger prick test. Kale unadungwa hapa kwa I think it's the pointing finger. Is it called the point that finger? Urine dipstick you get. Sometimes HbA1c if available. Please doctors, tuambie kama this information. Okay, let me tell you guys. I know chat GPT can be a little bit biased, but let's just look at everything from like a general perspective, And I would one day love to have a clinical medic come and actually take us through these differences kwa kinaga. Because right now I'm relying on this and I know it's biased because this is AI that has been fed things, so it can be biased. It can hide information. So I'd love, but generally we can see that this is something that is actually happening. Okay, this is something that is actually happening. So let's just see the diagnosis. So the basic tools are blood glucose, but sometimes HbA1c if available, but not always affordable or widely used in rural areas. So it's not available. So it's the urine mostly and the fingerprint. Many diagnoses happen late, often when complications, vision loss, kidney issues, foot ulcers have already started. I recently lost a business partner, and it was crazy because it was she had she had this what is it called, it's like a foot ulcer, yeah, for like I think it was it 2 years. It was a lot of years because she started limping at a very, 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 and she had this wound that was not. It was crazy. And then recently she passed. May her soul rest in peace. And it was diabetes related. So when I talk about this, it actually hits home because a lot of people are actually affected and they don't know where to because of, yeah. So treatment: first line, lifestyle advice, diet modification, physical activity, or first line lifestyle advice. Oral medication, usually metformin, low cost, widely available, sometimes sulfonylureas. So the insulin used in severe or uncontrolled cases, but affordability and refrigeration are barriers. Again, not everyone can afford a fridge. Follow-up limited. Patients may only see a doctor, nurse every few months due to long queues and few specialists, and sometimes they don't even have the means to get to the hospitals. Challenges: the access to shortages of medicines and testing kits in public hospitals. Cost: even basic care can strain families without insurance. Can you imagine? The focus: preventing serious and complications with low cost interventions. So US standards, oh my god, I'm even scared. Diagnosis: comprehensive testing, fasting blood glucose, HbA1c standard. That's like standard. Oral glucose tolerance test. Early screening is common, especially in overweight or high-risk patients. Patients often diagnosed before major complications. Treatment: lifestyle modification supported by dietitians, diabetes educators, and fitness programs. Wide variety of oral drugs and injectables. Metformin, sulfonylureas. Oh God, I don't know if I'm saying it right. GLP-1 agonist, e.g. I haven't seen that in the Kenya. SGLT2 inhibitors. Insulin, readily available. Multiple formulations with continuous glucose monitors and insulin pumps for some patients. Follow up regular checkups with endocrinologists, dietitians, eye doctors, kidney specialists. See that? Challenges: high cost of medications and insulin without insurance. Complex insurance rules can limit access. Focus: process management, yeah, early intervention and complications. So yeah, that's it. It's I'm not even going to the other one. So let me tell you guys. For one, I want to say this. I feel like our problems are, I don't know what to say it. Um, I'm having a lot of questions because having lived outside Kenya, outside the continent, had a lot of, I've felt a lot of mosquitoes. But I know that we have the Anopheles mosquito, but is it, one thing that I need to understand is Anopheles mosquito just in, Africa only, or, because other areas have a lot of mosquitoes, but I don't hear a lot of malaria problems. Okay. Another thing is who? Why do we have the World Health Organization telling us what to do? Another thing that I would love to ask is our doctors, as I can see from what I learned, they are fully, they're actually one of the best, you know. And for those who manage to go to the US and get these licenses, these doctors are some of the best doctors that you can ever find. Okay, they are so learned. They adapt in various ways. They are used to, like coming from Kenya, limited resources, limited learning equipments, a lot of limitations, but they still make it. So their head is very punctual and very, I don't know how to put it, but they're just good. They're just great. Hmm. But now, also another question is, are these problems, especially Kenya having communicable diseases, not Kenya, Africa having communicable diseases, and these other developing and developed countries have non-communicable diseases? Is it something that is being pushed? Is this, like the can I call them AI mosquitoes, the bio mosquitoes, the GMO mosquitoes that Bill Gates wanted to push around? Is that something that is going to bring other health problems in the future? He's maybe investing in, bringing a solution that is going to bring problems to our people in the future, and he will be there as the savior with the medicines, that he brought. You get, it's just a whole, it's a whole lot of things. Another thing is, I'm just here, looking at all of these things here. It's limited resources, limited resources, limited resources. So I'm just wondering, people are paying a lot of taxes to the government. A lot of money is being paid out. A lot of money is being paid to the ministers, to the CSs. Like, being in the government is one way of being rich. So my question is, why are we having limited resources to important things like, one, education, to health? Because I feel like these are important aspects in our lives. And I won't even start with agriculture, because that is another whole, and these two are actually, it's a lot. I can't even put them down here. And one of the reasons I used ChatGPT was just to show you a general perspective of where we are at as a country, and the limitations that this government, not just this government, the governments here. And one thing that I would love to tell the Kenyans, and I'm saying Kenyans because I haven't lived in another African state, but I would love to travel to Africa. It's beautiful. I'm telling you, Africa, Kenya, Africa as a whole has a lot of freedom, has a lot of resources, a lot of natural resources. It's beautiful. It has a lot of people who are very inviting, and hakukosangi crazy people in the market, one crazy person in the market, but a lot of people are great, you know. But what I want to understand is, what I want to tell people is, right now, I think we should look at ways as to how we can improve our states. Uh, and we may say, okay, this government is not doing right, but what about the next government? What are the things that need to be put into place that will help our future, help our children? Which policies? When it comes to education, what do our kids need to be taught in school, at school, so that they can help them in the future? Like right now, I feel like the education is just so blunt. It's nothing. I know a lot of people are benefiting from it, but I'm not talking about the doctor, the architects, although I would want them to upgrade a little bit. Yeah, the curriculum, I mean. But when it comes to other problems, like, okay, we need fertilizers for our farms. Can't we have factories that actually produce? The government can actually come here and sell some few shares, and the country can build it like that. Should we have like places like like, for example, in China, if you look at it, they have like different areas for different things. There's an area for plastics, there's an area for furniture, there's an, like, we can do that, we can. And I feel like that way every county can be at least in the same level. If we say that in the coastal area there's a lot of forest area, there's a lot of we can plant trees, and there's good workmanship, wood workmanship, and that can be a place where you can get furniture. And if those people are encouraged, and also there is agriculture, if those people can be encouraged, you can have woodwork furniture That can be an area where you can go to get furniture. It can be exported. Also, there's the oil refinery. It can be increased because right now it's actually giving us, I think, half of our needs. When you go to the northeastern area, we can have livestock farming. If we go to the highlands, we can have farmers being encouraged to plant our own food crop. They can be given tractors, fertilizers, subsidies, and it's something that can actually be seen, not just on paper. If the education system can help us, get to that level, if it can help us, like they can say in 5 years from now that factory will already be set. We need this amount of engineers, this amount of food specialists, this number of industrial chemists, this number of, we can move forward and also improve employment. Si kila saa kutuambia we will create employment when we are still importing basic things like plastic. So anyway, that are my thoughts, and I hope that one person from this industry can actually talk to us about all of these things, because these are just general. I know this is just general. It's just the tip of the iceberg, and it's yeah, it's a drop of salt in the ocean. But I feel like it's at least a starting point and something to show you guys that we need standards in our country. We need to start demanding for standards. We need to start demanding for changes. We need centralized places where we can come for medical whatever. We need a place where for every county, we have 47 counties. Yeah. If we can have 47 major hospitals that are fully equipped, and other, like we can start with one fully equipped, top notch, high tech, and then we can start from there. We need that in our country. We need to identify factories, which this area needs which factory, this area we need which factory. Yeah, because I know that we can do it. It's just that they are trying to. Anyway, guys, we'll talk next time. uh Today was a chat GPT day. I think we're gonna be having such days. We just zoom around, ask questions that, and see the general view and general perspective of things. Yeah. Have a great day, and subscribe, like, follow in my other pages. Yeah, this chat thing is good, right?